Unfortunately, there is a lot of false information floating in the internet, especially social media, about side effects of these medications that are some of not are true. So it's very important to be transparent with your team, with your patients, about the benefits of this vaccine and what it can provide to you. The side effect or the mild fever, chills, or headache you get is a lot less than actually getting the COVID infection itself. I experienced very little arm soreness and mild headache during my second shot, and I didn't feel anything about the first shot. There are many benefits. There are personal benefits and community benefit. In a personal level, you're protecting yourself and your family. So you want to protect yourself, and when you go home, you want to protect your family. By getting the vaccine, you're protecting your family. You're also doing a big favor for your community to prevent the person-to-person transfer of this virus. I'm hoping that other members in the community learn from people that have received the vaccine and see that they have not had any severe reaction or side effect. And with more information from CDC and lifting restriction on people that are vaccinated, hopefully that will encourage people to move forward. And hopefully one day we will reach herd immunity and we can have a normal life.
You do not catch COVID-19 from getting a COVID-19 vaccination. What it is how I describe it to a lot of people. It's, I'm a former educator, right? So I think about it as a pre-test and a post-test, right? So when you see a pre-test, you kind of don't really know what to expect. You're just kind of looking around at the questions. But then after you get a little bit of learning and education, the next time that post-test comes around, you're going to be ready to go and know how to answer. And that's what your body is doing. So the first injection, if you get a 2-dose series, is just kind of like your body just kind of figuring out what to do. And then with the second vaccination, your body's like, okay, we know what to do. We're going to respond. So it's just your body responding in anticipation of an actual COVID-19 infection. I think one of the key factors in deciding whether or not you get the vaccine is, if you have a primary care physician, is to establish a good rapport with them and have an open and honest conversation. But really, there are hardly any reasons. Majority of people who are immunocompromised, who have cancer, who have diabetes, a lot of conditions can still get the vaccine. Transparency is extremely important on all of our parts. And I think one of the key factors in transparency is, while you may receive information from your employer or you might attend a town hall, it's very important to do research on your own and make sure that you look at reputable sources. For instance, the CDC, listen to reputable newscasts like NPR, go to your local health department website and do your own research, so therefore you can verify this information that is being told to you via your employer or town halls or any other method that you might come across vaccine information.
In the 30s, polio was prevalent, and I unfortunately got polio, and so anytime there's a shot or a vaccination, having had that experience, I am ready and willing to participate.
I felt it was really important to get a handle on this disease and to try to, contain it, and the more folks got vaccinated, the better it would be.
I feel like getting the vaccine isn't just a personal choice, but more of a public service choice, because, sometimes we can get sick with this virus and not know it and spread to someone who could spread it to a loved one, and that loved one can be gone forever. So I really feel like we should, if we can, get the vaccination so we can get back to normal.
It was a very easy process, being that we got it here at the Chesapeake. It was almost seamless. My first shot, I almost didn't feel it at all. I had to ask her, did you do it? I didn't have any symptoms. I know a lot of people experienced, they had mild symptoms. I didn't have anything with both doses. There were no symptoms, so I think I had a very good experience.
I had no temperature. I had no reaction, no arm that hurt, no headache. It was like getting a pin point stuck in you, and that was it.
I'm not gonna lie, I was nervous. Like really, really nervous. My boss had to actually come and hold my hand because I don't like needles. So the first shot, it was, I didn't even realize that she had already done it. She was like, okay, 1, 2, 3, and just put the Band-Aid on my arm. And I was like, did you do it? And she was like, yeah. And it didn't hurt. That one was fine. The second one, though, I did get like a knot in my arm. I felt a little nauseous, upset stomach a little bit. But other than that, I didn't have any other issues.
With my second shot, I did wake up in the middle of the night freezing. I wasn't in pain. I was just freezing. I couldn't get warm. It lasted for a few hours and then I was fine. That's a small price to pay, a very small price to pay to make me and everyone else a bit safer.
I get to visit the residents and other people around the building who I've been really trying to avoid, just to make sure I don't get them sick. So now that I've gotten the vaccination, there's less chance that I'll spread it to other people. So I get to have more personal relationships with the residents and other staff members.
The staff is as much a part of the Chesapeake as the residents are. And they're fine people. I care about them. I feel like they're friends of ours who look out for us and take care of us. And I have as much concern for their health and their safety as I do for the residents.
We have not asked them, but I can remember one good friend coming to us one afternoon and said, I got the shot. And that meant a lot.
Yeah.
I had an uncle who died from the pandemic of 1918. He didn't die, didn't catch that Spanish virus, that Spanish flu, and die of it until 1921. That's 3 years after the pandemic started. We don't want to do that. We need to stop it now as quickly as possible. So that's what I say. Let's everybody do our part and get rid of it.